Hello, welcome to What About Us? PPE Inequality Among State Prison Populations During COVID-19. My name is Dr. Stacy Merkin, and my research colleague is Dr. J. Carly Purdom, and we are going to be discussing our research with you. In terms of the introduction, the COVID-19 pandemic has been absolutely devastating for incarcerated populations across the US as well as across the world. Incarcerated individuals often lack any type of equitable access to resources in order to prepare for, respond to, and recover from all types of disasters. And this remains also an overlooked issue, largely to limited information that is distributed and made accessible for public consumption. However, the COVID-19 pandemic's far-reaching impact provided an opportunity for us as researchers to observe how state prison systems and how these individual states and their units make decisions about certain resources, specifically looking at personal protection equipment, PPE. In terms of the background, the US prison system operates very differently from the rest of the world in that each state has their own autonomy, having their own Department of Corrections or Department of Corrections and Rehabilitation. DOCs is how they are referred to. Prisons are disproportionately vulnerable to infectious diseases. They run rampant in this type of environment. And a lot of that has to do with the overcrowded conditions that are caused by mass incarceration starting from the 1970s, as well as the prison building boom in the 1980s. Prisons are often over capacity, they are overcrowded, leaving very little space for individuals to properly social distance during the time of COVID. And the characteristics of incarcerated people, such as their age, medical in terms of medical impairments, elderly incarcerated individuals, as well as even mentally ill individuals, are very vulnerable to any type of disaster, and specifically looking at COVID-19.
So for this paper, we collected all available COVID-19 updates and relevant press releases that were available on each state prison agency's website. So we collected those releases and we used grounded theory to do a content analysis on them. And in that analysis, we analyzed them for emerging themes relating to specifically the distribution and the access of personal protective equipment, or PPE, in terms of incarcerated persons and prison staff and their access and access to PPE. So to address the differences among states, because there were some significant differences among agency and the amount of information they released and the quality of that information, how frequently they gave updates, what they talked about. After that first initial analysis, we went back and sort of filled in the blanks using news media reports and official agency social media posts to find that more detailed information to answer these initial questions that came up through that first analysis. So in terms of our results, we really organized our findings in terms of these different emerging questions from that content analysis. The first is, what PPE was given to incarcerated persons, and probably the most common PPE that was distributed were masks. What we found, though, was this disparity in the quality of masks that were distributed. So incarcerated persons were given access to these cloth masks, while staff and prison staff, including prison guards or corrections officers and other staff, were given access to surgical masks, or there were a limited number of staff that were given access to N95 masks, while incarcerated people did not have access to that higher quality level of mask. There was a disparity in access to quality hand sanitizer, which was another frequent issue for PPE that emerged in terms of many states did not give incarcerated people access to hand sanitizer at all. Those that did would have them distributed through staff, where staff would have access or to that PPE and be giving it out individually or kind of monitoring the distribution in common areas. And then there were a handful of states that did not give alcohol-based hand sanitizer, but gave a non-alcohol-based hand sanitizer to the incarcerated population, which was against CDC guidelines in terms of hand sanitizer. Incarcerated workers were sometimes given additional PPE compared to the general population, especially those that were used for janitorial cleaning services. Again, it's important to note that incarcerated people do not have the right to refuse to work. So many were, commandeered and put into these working in these cleaning positions. But they would, some states went into more detail about that they did give those janitorial cleaning services additional PPE, such as gloves or gowns to use while they were cleaning. Incarcerated persons produced the majority of all the PPE that was available in U.S. prisons using their state prison industries. So the PPE that was available in the prisons for prison staff, for incarcerated people, was produced by incarcerated people. And yet COs or corrections officers and staff were given masks first, even before we saw many examples of even before the workers who are making the masks were given masks in the beginning of the pandemic. So even though incarcerated people were responsible for producing all of the PPE within the prisons, they were the last to have their PPE and needs met in terms of masks specifically. So our second question was, did incarcerated persons produce PPE that they did not have equitable access to? And the answer is yes. So incarcerated people were producing masks that they would not have access to in terms of producing surgical masks and N95 masks. They were producing the fit testing hoods that would be used for staff to be fit tested for N95s. They were producing face shields, protective eyewear, protective gowns, protective suits, that high quality hand sanitizer that they would not, often that they did not have access to, head covers, shoe covers, really all of that PPE that could be produced in those factory settings was being produced by the incarcerated population, but they in terms did not have access to that PPE. And again, COs and staff were given those masks first before those factory workers were given masks. PPE that was produced by incarcerated persons was then distributed to other state agencies and community entities, framed as a service, not just a service the incarcerated people were doing, but as a service that the prison system itself was providing in terms of the disaster, even as states were not responding to the vulnerability needs of the incarcerated population. They were trying to use that population to meet the needs of the free population. Incarcerated persons were working in conditions that violated social distancing measures and often without access to PPE. We saw this especially in the beginning of the pandemic, where there were many agencies that were posting videos or images of their factory settings with incarcerated workers, producing that PPE, making that PPE in very crowded conditions of that factory setting without the use of masks and violating those social distancing measures.
And from our grounded theory research, our third question that emerged was, how did perceptions of incarcerated persons as hazardous impact the distribution of PPE? Well, what we found was that in certain states, individuals that were incarcerated were denied hand sanitizer. They were considered to be a danger to themselves and others in terms of accessing that hand sanitizer that did have alcohol and actually possibly drinking the hand sanitizer. And also there was a restricted use of masks due to security reasons. So there was a potential threat in terms of security protocol, and these individuals were told that they could only wear masks at certain times of the day. And if they did not follow said protocol, they would end up having some type of disciplinary action being written up for refusing to take them off. So as we saw here, there was restrictions for these individuals in terms of using PPE that is supposed to protect them, which in turn, from these restrictions, actually made these individuals as more of a danger to themselves with the potential issue of contracting COVID-19, especially in these types of conditions where a lot of prisons are full of squalor. Number 4, how did gender influence the distribution and access of PPE? The labor distribution was unequal to the point where we saw female incarcerated workers. They were unusually visible to the prison industries. As you can see in the picture below, we have a picture of these women that are incarcerated working in a PI factory. And incarcerated women were also viewed as more trustworthy with hand sanitizer than with men. And this leads to what we consider social constructionism, where we are looking at how gender is portrayed in society, the expectation of women who will obey and take on these more gender types of roles, making gowns and so forth, whereas with the men being more masculine and most likely to disobey.
So in conclusion, our results demonstrate what has been shown throughout the pandemic, and that incarcerated people continue to have inequitable access to resources in the context of disasters. We've seen that even as they are responsible for being the labor that produces PPE, that labor is exploited to reduce the vulnerability of others, even at their own expense, where the conditions they're making that PPE in expose them to COVID-19. But it also is in line with other previous research that has found that incarcerated people are not prioritized in terms of their vulnerability and access to resources and disasters in the same way that their labor is focused in terms of what can they give as opposed to how can they be protected. And these issues continue to have a disproportionate impact on racial and ethnic minorities due to their overrepresentation in prisons, which reflect significant environmental justice concerns. And that's something that has been seen throughout the impact of the pandemic. This is just another way in which historically marginalized and oppressed communities are going to continue to bear this higher impact of COVID-19. And this is one avenue in which that continues to happen. So that's one significant conclusion that can be made in how those, just another environmental justice concern and the impact of COVID-19 on those marginalized and oppressed populations.
And the pandemic is ongoing, it is continuous in the US and across the globe. And distributing quality PPE equitably across incarcerated populations remains a significant tool for hazard mitigation of the COVID-19 pandemic. It is important to remember that 90% of individuals that are in prison will be released at some point. And if they are unable to contain such deadly viruses as the COVID-19 pandemic and are not providing the appropriate PPE equipment, we could see increase in outbreaks in the future. As researchers, we do plan to expand our analyses to include access to vaccines for incarcerated individuals and looking also at other components that come together in terms of hazards and mitigation and disasters. Thank you so much for listening to our presentation, and we hope you are enjoying the conference.